today we'll be looking at health matters during COVID times, and they'll be brought to us by Harriet Koyason from the Strathmore Business School. And we start off the program by doing housekeeping. My name is Phyllis Maitha. I'm the head of membership. Thereafter, we will have the introduction of the speaker brought to us by the CEO and ED of KIM, that's Muriithi Ndegwa. And thereafter, we'll have the keynote address by Harriet Koyason, and we will have question and answers. So without further ado, I wish to invite Muriithi Ndegwa to welcome us to today's webinar.
Good afternoon, everyone, and thank you very much, Phyllis. Members, once again, we want to thank you very much for joining us for today's webinar. And I can see some very many familiar faces, people who've been with us before, ever since we started these webinars. So to all of you, welcome on board. Without further ado, let me just, before we invite the speaker, just give you some little background in terms of today's discussion. We are still on the topic on health matters during COVID times. And we all recall that since the first announcement of the first COVID case, which was way back on 13th of March, when the government announced the first COVID case in this country, we've gone through some very tough times. Many of us would recall the first few days when none of us, or many of us, didn't know exactly what was going on. And we were relying a lot on social media, relying a lot on the news, and of course on the government announcements which were being done on a daily basis. But as a country, we also later went on lockdown, and it's not until recently when we started resuming normalcy, albeit with a lot of caution and guided obviously by the Ministry of Health protocols. We have also experienced very good communication, especially from the Ministry of Health, where on a daily basis they've been giving us the daily count on the cases and so on and so forth. And I do believe this has also helped a lot of us in terms of planning ahead. However, if you look at the global position, the global situation, there are very many countries that are still going through some very, very tough times. And I know Harriet will be talking to us about that. But more importantly, it's a question of what happens and how do we handle these situations. So today we are gathered to listen and learn on health matters during COVID-19 times. But allow me to maybe firstly mention about KIM. There are those of us who would know, obviously, that KIM is a membership-based organization which has been in existence since way back 1954. We encourage that if you're not a fully paid-up member, that means you're not a bona fide member, please endeavor to register, because all the presentations, including the one which is being done today by a speaker, will be posted to the members. And so it's important that if you want to benefit from your membership, please pay up for your membership so that it becomes bona fide, and we'll endeavor to send you the presentations. We'll be putting details on the chat. It's very easy. You simply just log on to the website and then indicate the category of membership that you want to join. And based on that, then you'll be given a prompt and you send your money on M-Pesa. And that's it. There are also programs that we are currently running. We've been running a lot of our programs online. But effective 12th of October, which is Monday this week, we resumed our normal operations by returning to work. And effective 19th of October, which is Monday next week, normal face-to-face learning will be conducted in our branches, but of course, under the strict guidance of the Ministry of Health protocols. But over and above that, we'll also be having online learning. So it's going to be face-to-face for those who want to do face-to-face. But for those who are the majority who may want online, that is still continuing across the board in all our branches and also from head office. There are several programs that we are also running on certification courses. And like we've said before, for those of us who perhaps have a little time, and I believe every one of us has a little time, there's nothing as important as sharpening the tool or retooling, as some would call it. So please endeavor to register for some of these professional certification courses, because they'll add a lot of value, not just to the current life, but to future life. And we'll post details on the chat about these details. Last but not least, it's also important to let you know that, especially for those who may be having children who may not have returned to school as yet, or even grandchildren, again, please endeavor to register them for some of our courses, because that will add a lot of value when they do their KCSE or whatever course they are doing, because it adds onto one to be able to reach to be able to get the job, the right employment in the job market. There are also programs that we are running, and we'll also be posting that on the chat, including the future annual managers conference, which is going to be catering for managers in Kenya, Uganda, and Tanzania, indeed in the whole of East Africa. We'll also be having Women in Leadership Conference, which is very, very ideal for women and even for men. Let's support our ladies. And there's another one called Managing in Heels. Perhaps a little later during the program, we'll be putting these details on the chat so that every one of us is aware. Now, let me just end with a quote. And this is a quote that many of us may have seen by IFC, the managing director of IFC. And she says, and I quote, "Given the nature of the crisis, all hands should be on the deck. All available tools should be used," said Lagarde. "We are providing support as attractively as we can so that from the household to the large big corporate account, all economic players can access financing through their banks," she added. I don't know how apt that is for us today, but ladies and gentlemen, allow me to invite our speaker. But before we invite her onto the floor, now, the speaker today for Health Matters during COVID-19 is none other than Harriet Koyoson, who is a Director of Health Services, Strathmore University Medical Center. And as Director of SUMC, Harriet has been the driving force behind the setting up and management of the Strathmore University Medical Center, which is a busy outpatient care center focusing on both general primary care and specialist care. SUMC caters for all age groups of patients, from geriatric to children, and SUMC is also a center for research, driving for homegrown healthcare solutions. This is sure to set Strathmore on the map as a medical research hub internationally, paving the way for many more milestones. Ladies and gentlemen, without further ado, let's invite Harriet Koyoson. Harriet, this is your floor. Please take the floor.
Thank you, Mureithi Ndegwa. Thank you for that enthusiastic introduction. I think it has set the mood very well for this talk that you're going to have. I can see your members are logging in. So karibuni, all my friends. I feel like I'm amongst kindred spirits because I am also now, although I started in healthcare, I'm very much entrenched in management. So I am a firm believer that good management is very important for the success of any organization, whether it is financial, business, education, or whatever it is. So today I'll be taking you through a presentation about health matters during COVID times. And as Phyllis and I were thinking about, how to position this talk, I still think it's still very relevant to talk about COVID, because the information coming out of the global health authorities like the WHO, the CDC, are saying that this disease will be with us for a minimum of 2 years. And I remember in the beginning of the first wave, because we are now going into the second wave. In the beginning of the first wave, when the WHO director was giving a press conference, and he had invited the director of the World Bank, and what he said there was very important, which I think is also very relevant to this group, that while we are in this pandemic and riding the storm of this pandemic, it is very important to remember that we must balance between lives and livelihoods. Okay, so as much as we would love to focus on lives only, to save lives as much as we can, there's also the issue of livelihoods. People still need to get out, conduct business, earn their daily bread. And of course, that was one of the biggest things that was worrying in Africa, because in Africa, a lot of us work for the food we eat today through the informal sector. Very few Africans are actually employed or integrated in formal employment, where like some of you, like myself, we can work from home, we're given tools. There are actually people who, if they do not leave their houses, cannot make a daily living. So as we think about health in COVID times, it's always good to remember in that background that we must reach a middle ground where we allow people to continue with their livelihoods and at the same time save as many lives as possible. Just to give you some update, I am not the minister, but at the moment, the global figures of confirmed cases of COVID are 38 million, which is around the whole population of Kenya. And there have been just over 1 million deaths. In Africa, we have about 1.2 confirmed cases, and we are very thankful that the death rate has been very low. The scientists are still out on why Africa has not faced a big brunt of the pandemic, but at the same time, we cannot let our guard down when it comes to COVID. So at this point, I would like to get into my presentation. So when we talk about health, it's very important to remember that our health, it was a matter of importance even before COVID. I think what COVID has done, it has brought it right to the forefront, because COVID is not a respecter of social class, it's not a respecter of age, it can affect everybody. Many times when we talk about global diseases, young people who I work with very much always think, that is not my problem now, that is a problem for wale wamefika a certain age. But with COVID, it has brought to light that our health is very important, and being healthy at any age is important. When you're young, it is important to be healthy because you're setting the foundation for your future health. And if you're older and you've had good health, it is very important to maintain it. And if you're older and you may be suffering from a health challenge, there is help. So there is a lot of focus now on wellness and preventive health. I don't know how many of you have been to any of our hospitals very recently. You will actually notice that there has been a decline even in patient numbers. And everybody's asking, why are people not going to hospital? But what we realized, something very interesting is happening. When COVID came, the directives employed by the government of Kenya were very simple, that people should put on a mask, people should social distance, and people should observe hand hygiene. And has been realized that when people do that, actually the rates of infection for all diseases goes down. So we are seeing less cholera, we are seeing, on Monday in a typical health center, we'd be seeing diarrhea because people have eaten in strange places over the weekend. We would also be seeing a lot of coughs and colds. But now that everybody is generally, observing hygiene protocols through work or through what the government has put in place, the level of disease burden generally has gone down. And if you look at the first graph that I have given, you will notice like the first 3 diseases that affect Africa are actually what we call infectious diseases, or what we call communicable diseases. So they must be passed on from one person to another by some sort of organism, whether it is a bacteria or a virus or whatever it is. So the burden of Africa in terms of disease has always been infectious diseases. However, because we are very good at, or rather I think we are on the track to globalization and industrialization, we're also adopting Western lifestyles, okay? And because we're adopting Western lifestyles, we are also increasing our burden of what we used to call, or what is called, non-communicable diseases. So these are not diseases that are generally passed on by bacteria and viruses, but these are diseases that are actually driven by the way people live. So if you look at, now look at the top 10 causes of death in Africa, then you start seeing the lifestyle diseases starting to make an appearance. Yeah, we have ischemic heart disease, which is coronary heart disease, which is caused by lifestyle because it is driven by hypertension. Then we have diabetes, which is a big one. Yeah, again driven by lifestyle, and here we're talking mainly about type 2 diabetes, not type 1, which is what somebody is born with, but type 2 diabetes or diabetes mellitus is the one people acquire later on after they are born, and is mainly driven by lifestyle, how people live. So as much as these non-communicable diseases, or they're called NCDs, are growing in number, you know, one of the hopes we have is there's a link. If NCDs or non-communicable diseases are driven by lifestyle, what is the intervention? The intervention is to make people change their lifestyles. Okay. And we know how difficult that is. At the beginning of this pandemic, I was called into a webinar on the challenges of COVID in Africa. And one of the biggest things was people were not even following simple directives that required behavior change. People were not social distancing. People will not be wearing masks. Masks were in the car, but people would only put them on when, you know, they're at the traffic and the policeman is watching. Even hand washing was a problem. So we've actually realized in the health sector that the hardest indicator to change is human behavior. Okay, human behavior is very difficult to change. And we have realized that many of the diseases now that we're going to face in the health sector are actually behavior driven. So how can we then, these are now some of the things and the questions we need to ask ourselves. How can we then change our behavior? And by changing our behavior, change our habits, and by changing our habits, then have healthier lives. Okay. And here I would just like to ask a simple question. And I think, Phyllis, you'll help me with checking the chat. How many of us here, I'm used to Zoom, so I don't know if we can raise our hands, but how many of us here have a family history of diabetes or hypertension or heart disease? Maybe by show of hands. A family history means either your mother had it, your father had it, your grandfather had it, an uncle, a brother. Okay, I have seen, yeah. Phyllis says she has family history of diabetes. We're about 22 of us here. Do we have any other people? Okay, so I'm talking to a pretty healthy group. But mainly, many times you will find about, 60% of people in any given population will have a family history of diabetes, hypertension, and heart disease. Okay, either through their grandparents or their parents or siblings. Phyllis Wambugu says, not us, sales drives Kenya. Yeah. So these diseases are here with us. Now, from a health perspective, we have noticed is before, when we used to see these non-communicable diseases, we used to see them in generally older populations. So people above 65, 70, getting hypertension. But in the past 10 years, we're seeing the age is dropping. Okay, so we are getting 45-year-olds, 35-year-olds, 39-year-olds with well-established hypertension, well-established diabetes, and therefore we are seeing, actually it is true, we are beginning to pay for the lifestyles that we are living. The next slide, please. Okay, so this was just an example of showing the disease burden. So you can see in Africa, we have a mix of the red and the blue. So that means when people talk about Africa and low to middle income countries, they talk about double disease burden. So we are barely managing infectious diseases, but also we have the burden of non-communicable diseases. In the West, they mainly focus on non-communicable diseases. They hardly have any infections, except now with COVID. And in fact, I think this is probably one of the reasons we have done better, because we're always dealing with infections. Okay, so we've become, it's somehow in our DNA in Africa to handle infections. In Europe, if any of you have been there, or in the West, everything is sterile, super clean. Yeah. So as soon as an infection comes, it is very virulent for them. Okay, our next slide, please. Okay, so what are the risk factors? I talked about Africa being one of the fastest economies growing. Africa is poised to be the largest market in the world in the next 10, 15 years' time. So anyone who's not doing business with Africa is not going to do any business at all. But unfortunately, with growth also comes problems. But so with our fast track to industrialization, we're also on the fast track to Western habits. Okay, so this slide I have put is on the risk factors. Yeah, so when we look at the risk factors of what is causing health problems, especially diabetes and hypertension, and you may be worried, you may be thinking that why are we talking about these things, and this is a talk on COVID. It's because we've also realized that people with underlying conditions of hypertension, diabetes are the ones who are being seriously affected by COVID. One of the reasons that have been put for Africa not having such high numbers is our young population. Yeah, and our young population are generally very healthy. But with the older ones, maybe not so healthy. So if we want to look for a root cause solution, we have to go back to how are we living? What are our lifestyles? And these are technically the risk factors of health. Yeah. So if you're looking to live a healthy lifestyle and have a healthy body, we have to manage these risk factors. Some people will argue there's nothing I can do about it, but we all have to do something about it. One of the things you can see there, I've put some traffic, some cars in traffic. A lot of us are working long hours. We spend our time sitting in traffic. I know there's some studies that are being done on, the effect of that on the human person, because there must be an effect. It is not normal to commute 2-4 hours every day just to get to and from work. So those of you in organizations and are in positions of leadership, one of the things you can do coming out of this pandemic is trying, as part of your wellness program, is can you introduce flexi hours, working from home, yeah, as one of the things to increase productivity. Because if somebody is spending 4 hours just commuting to work, and maybe out of that they would have given you good productivity, it is something as organizations we all need to think about. The other thing is, of course, the BMI of the world population is growing. Yeah, if you take the average weight of the human beings in 1995 to 2010, it has moved from 15% to 25%. So that means, and that is about 10 years ago. So if you add another 10% to 2020, you see we are becoming, for lack of a better word, fatter. Okay, so our BMIs are going up. And what is causing our BMIs to go, and what is causing this obesity pandemic? I know if you talk to everybody during this pandemic, if you see them, their cheeks are looking a bit rounder, the waistline maybe has disappeared a bit, but it is affecting us. Yeah, so we have to realize that it is what we eat. Okay, and there I have put some junk food. One of the things we were talking with one of my doctors who runs a diabetes clinic is how busy Glovo, Jumuia, Jumia, and all these food delivery companies have become very, very busy all of a sudden. Yeah. So, you know, if you lived in Nairobi 10, 15 years ago, many people ate home cooked food. Now everybody's eating food cooked from outside. And what do we know about that food? It is highly processed, probably cooked in a lot of fat. Yeah. Many times it is not balanced. Okay. So, and the junk food craze is there. I mean, you just have to drive, you know, along the streets of Nairobi, and the food advertisement will just hit you. Buy one, get one free, terrific Tuesday, you know, wacky Wednesday, you know. So food is being driven at us. And I know in the US, there's been a big movement, especially when Michelle Obama was the first lady, of how to, she was saying, you know, selling junk food to children is equivalent to selling cigarettes to children. Yeah. Because the danger of high fat foods or foods with a lot of sugar is real. We also have a very sedentary lifestyle. We don't move a lot. Okay. That's another thing people realized. We don't move as much as we should. Yeah. Most of us who have desk jobs, on average, if you count the number of hours you sit, you get into your house, get into your car, sit in your car, commute, get out of your car, sit in the office from one meeting to another. Maybe the only walking we do is at lunchtime when you're going to look for food, sit and eat, come back, sit again, sit in a car or in whatever mode of transport, and you go home. The other risk factor that is actually being identified with bad health is lack of sleep. People are not sleeping enough. Yeah. I don't know why. Some claim they have a lot of work, but when I talk to the younger generations, I think the culprit is the internet, it is Netflix, and basically not managing time well. Yeah. And the best thing for any human being scientifically is to sleep 7 to 8 hours a day. On average, people are sleeping 5.5 hours. So many people are sleeping 5, 4, 5.5, 6 hours. So it is good to also look at how are my sleeping habits. Yeah, how are my sleeping habits? Because lack of sleep causes stress, and stress, you know, is a factor now to all these other things. Then, of course, the next pandemic that the WHO has actually identified after COVID will be mental health. Yeah. Mental health is now big. It is very, very big. Why? Because we've been in a pandemic. If I ask who has been in a pandemic before, I'm sure no one will put up their hand. So there's a lot of anxiety because of the uncertainty. Nobody knows what will happen. You don't know whether you'll get COVID. You do not know whether a loved one will get COVID. You don't know how they will be affected by that. We don't know how all this will affect the economy. We already know, somebody was telling me, I think we've lost 1.5 million jobs. Yeah. So many organizations have taken salary cuts. The joke was, you know, now if children are going to school, first of all, they've eaten so much. The parents have eaten the school fees, and the children have eaten, and the uniform doesn't fit. But what does that mean for a parent? It's financial strain. And maybe now you have to have expenditures that, you know, with less income. So there's a lot of stress, a lot of panic, there's anxiety, there's depression. And then, of course, it is not helped by our culture, where we are very stoic. You know, people don't want to say when they have problems. People don't want to reach out. So we have to be on the lookout for what is happening in the minds of in my mind and in the minds of those around me. Next slide, please. Okay, then this is another disease that is on the rise and the rise. Yeah, it is October, it's Breast Cancer Month, Breast Cancer Awareness Month. And of course, we cannot not talk about it, but cancer is also on the rise in Africa. Okay, again, why? Because of lifestyle. Cancer has been linked to diet, has been linked to lack of exercise. Of course, there's the fact that, you know, you can inherit it through family genes. But again, it is lifestyle driven. Okay. And for women, these are the Kenya figures for 2019. You can see for men, the most common cancers are prostate cancer. Then Kaposi sarcoma is normally related to HIV/AIDS. I guess that is why it is high. Throat cancer and colon cancer and cancer of the stomach. So that is what is common for men. For women, it's cervical cancer and breast cancer. Now, when I look at these cancers, they all can be caught by screening, aggressive and regular screening. Okay. If I should ask another poll question, how many of you have gone for a medical checkup this year? I can see someone shaking their head. How many of you? If yes, can we have a thumbs up? If no, thumbs down. How many have gone for a medical checkup? Some cameras are not on. Yeah. But I keep saying medical checkups are there. Yeah. And they're there for a reason, because you've heard the saying, a stitch in time saves 9. There are many diseases now, if they're caught early, can be managed. So, and cancer is one of them. This is Breast Cancer Month. The women in your lives, the one you love them, do you encourage them to go for cervical cancer screening? Do you encourage them to go for their pap smear every three years? Do they know how to do a breast check on themselves to know if there are any early signs of breast cancer? For men, after the age of 65, even 60, you should regularly be doing a PSA. A PSA is a marker for prostate cancer. Yeah, so that should be included in your annual checkup. Colon cancer also seems to be on the rise, and this one is directly hereditary. So especially amongst what we call first degree relatives. So if I've had a parent or a sibling who has had colon cancer, from the age of 45, 50, I should be getting a regular, what we used to call a colonoscopy, to check for early growths of tumors, because these are diseases when caught early. Actually, the survival rate is very good, and people live very long when the cancers are found early. Okay, the next slide, please. Okay, then we talked about diabetes. Now, this one is a big one. Yeah, this one is a big one because many of us are working with high sugars and we are not even aware. The prevalence of diabetes is growing more and more. I remember a few years ago, we had a screening event for diabetes at Strathmore University. And basically, we even opened it up to the general public. And I remember one of the nurses coming and saying, "Look at that man. He was as thin as a stick, but his sugars were so high." Yeah. So, and we kept thinking, but this is someone we never would have assumed has diabetes. So what I'm trying to say, some of these diseases cannot be identified just by looking at someone. They have to be done through testing, through screening, through going for annual checkups. Okay. And the risk factors for diabetes also are very modifiable. Yeah. It is how much refined carbohydrates are we consuming? In fact, our African diet was the best diet. Everything was brown. Yeah, if it wasn't brown, it wasn't. So there was brown ugali. We ate whole, what I'd like to call whole high fiber starches like sweet potatoes, arrowroots. Even if we cooked meat and vegetables, there was very little oil. Yeah. So, and then apart from abandoning our good African diets, we've also become sedentary. I mean, the typical thing, I'm sure when you go up country, yeah, if you were to get into the routine of people of our country, you realize they walk a lot. Yeah, when you had to go to the market, you walk. You had to go and fetch water, you walk. If you are herding animals, you walked the whole day, isn't it? Yeah? So I really don't know if borders are a good thing because they have made us very lazy. Yeah? All of a sudden, distances that people used to walk, everybody's taking a border. But we need to think Are we kicking out the very thing that has kept Africa healthy for so long, which was physical activity? Okay, next slide, please. Okay, and then I talked about mental wellness. Yeah, the need to talk. I don't know how I can stress this enough, because we have seen a lot in this COVID time. In our university, we have a mental health hotline where people can call and get online counseling, advice. And I can tell you, my team have told me that since we went into lockdown, they have been very, very busy, very busy. I am happy they're busy because that means there are people who are talking. But when I speak to them and I ask, who is using your hotline? They'll tell me it is young people, between the ages of, 15, 16, 17, 18 to their early 20s. We're saying we hardly see we don't see their parents. Yeah, we don't see people in the older age groups. So are we assuming that they're coping or not, So there's a lot going on, I think, because if you look at the workplace, if you look in families, there's a lot of stress, and understandably so. But are we seeking help? Are we looking for coping mechanisms? Yeah, because as long as COVID is here, we will all be under duress. We'll be all under mental stress. All of us. No one is exempt unless you're a robot. So find your way of coping with mental stress. Yeah. I keep thinking when the president opened the country, the first thing that was fully attended was not even the churches, were the bars. So I was thinking, is that Kenyans' way of de-stressing, or why are people very stressed in their houses? Another thing that I also became aware of, because if you talk to people and say, oh, how are you finding COVID? How has it been? Some people are thriving. They're saying, oh, finally, I can be at home. I can be with my children. But the other day, I spoke to a colleague and said, I live alone. The office was the only place I came and interacted with people. And if I don't come to work, then I don't have people to talk to. So there's a lot of loneliness as well. So just because maybe things are going well for you, being at home, working with the new situation during COVID, it is not the same for everybody else. So we have to be aware of these things. I'm sure KIM, we are all managers, we're all people. We have teams under us of different ages. Yeah. How can we then support these people who work for us? Do we know what the warning signs are that somebody is not coping, that somebody is not doing well, that somebody needs help? Do we know where to refer them to? Yeah. As I said, that I have been seasoned in the School of Management, and I realized that the biggest asset you have is your people. Yeah, they're the biggest asset, more than buildings. If you ask any company now whether they need to rent the space they had before, many of them will say maybe yes, maybe no, but they will tell you they still need their people. So our employees are our biggest assets. So what do I recommend for you as managers, as leaders of organizations, as leaders of teams? Is and as individuals, we are moving away from reactive health management, where I fall sick and I run to hospital. We're taking a wellness approach, a proactive approach, a preventive approach, okay? Because we have seen for ourselves, when we've worn masks, we've washed our hands, the diseases have disappeared, at least the infectious ones. So it has shown that can we all take a preventive approach to how we manage our health? I always say, you're given one body at birth, yes? And it has an expiry period. I like to put these two cars here, yeah? And we can all ask ourselves, we don't need to share. In terms of those cars, which one do you feel like? Do you feel more like the sports car, or do you feel more like the tow truck? Yeah. And it's true, sometimes we might feel battered. Maybe we've neglected our health for whatever reason. We're too busy, or maybe I didn't know what to eat, or I'm too busy to cook, or whatever it is. But I always tell people, you're born with one body and you need to make it look like that sports car. It has to be a machine that serves you well. Yeah. The human being, when they live well, can live up to 100 years old. I don't know if you go online and you see all these people who have made amazing changes in their lives, even as late as the age of 50, 60, they started walking, taking marathons, exercising, and their lives just changed completely. And I always tell people, these things are free. Walking is free. Running is free. You don't need to join a gym. There's a very nice one. Maybe at the end, Phyllis, you will allow me to share it, yeah? Of someone who in her late 50s, I think, she went through a depression. And one of the things she was advised was to start running, okay? In her 50s. She had never exercised before, ever. But she started exercising. And now she's a you know, these triathletes, the ones who run, swim, and cycle for so many kilometers, up to her age in her 80s. And I'm sure she's healthier than many of us in this forum. So let us take a proactive wellness approach to our health. Next slide, please. I can see Phyllis has already started by drinking water. Okay, so what we are looking at is total health management. Yeah, we can't just focus on one health system. And I like this because it shows all the health systems. We focus on our circulatory system, we focus on our muscular system, we focus on our bones, our hormonal systems, so everything, total health management. Next slide, please. Okay, so why is health important? I thought I'd put this for you again as managers and leaders in your industry, because a healthy workforce is good business. Okay. The other day, I don't know about you, but we're all being told you have to take your leave by the end of the year. I didn't understand why, yeah, because I wouldn't know, you know, why people would want people to be on leave now. Yeah. But then my husband, who's in finance, explained it. You know, he said leave is a liability in your books. If people don't take leave, it's an expense. Yeah, and I think it's a good way of thinking about it, that if my people are not healthy, if my people are not taking breaks when it is necessary, it is actually an expense. We know the expense of replacing a human resource. Yeah, when somebody is sick, when somebody leaves your organization, maybe because the work environment is not conducive, to replace that person is costs you much more than whatever intervention you would have put to keep that person within your organization. So we need to remember that a healthy workforce is good business. One of the things that I encourage a lot of organizations right now is to seriously think about employee wellness programs. Okay, and I'm not just talking about you know, getting a medical cover and, you know, giving them limits. No, because that again is reactive. Yeah, you're encouraging people to go to hospital when they're sick. Yeah, so what I'm advising is, what can you do as managers of leaders of our organizations to make sure that people are well and don't have to go to hospital? Yeah, and I think this discussion needs to happen at a very serious level. I'm sure there are people here in insurance. Yeah, can insurance give rebates if somebody year on year comes back with good parameters? Yeah. And you're not costing the organization money. Yeah. So we have to think of how we can incentivize people, how we can have these wellness programs looking at all the dimensions, from physical health, emotional health, intellectual health, social, spiritual, environmental, and occupational. Yeah. So I always say, all those people who are in the HR practice, this has to become part and parcel of the way we run organizations at the moment. Okay. So what do we at Strathmore do now towards health? Okay. If you go to the next slide. Okay. Okay, so at the medical center, we basically, as was mentioned in the bio in the beginning, what we're looking at is how can we then create health solutions that are relevant for our markets? You see, many of the health products we receive are from foreign markets. And I think even what this COVID has taught us is you cannot assume because there'll be a pandemic that everybody will get it. Yeah. Yeah. So many times as an educational institution, we are driving the agenda of how can we do differently? How can we do things differently when it comes to talking about health in Africa? Right from treatment, right to prevention programs, to even coming up with drugs. Yeah, I'm sure all of us, you know, you've heard of mitishamba. Yeah, I remember when I was when I was young in the village, and you'd have a stomachache, maybe because I ate some dirty thing. My grandmother would go and pick some yellow flowers, and she would grind them and give us to drink. You know, we don't know what molecule that is. Yeah, that could be maybe it could be the same molecule that has made the big companies like GSK and the rest. So how can we drive the health agenda, come up with homegrown solutions, come up with home researched and grown products for healthcare? Yeah. So there's a lot that can be done there. So that is one of the things we're trying to do in Strathmore, is to develop that research in healthcare, which especially in terms of drug research, which has been a bit lagging in Africa. So in our medical center, you will find, if you come, we do have programs where we're doing research in different areas of health, which I will explain as we proceed. Next slide, please. Okay. So in Strathmore, you will find that we have focused on certain disease areas. So as much as giving primary care, we are trying to specialize in, first of all, what diseases are we seeing in our population? And two, what diseases can we do research so we can actually start giving, again, Kenyan solutions to the diseases that are affecting us. So one of the things that we have found that is very key is hypertension and diabetes. So we run a very good hypertension diabetic clinic amongst the other clinics. And with this clinic, what you're trying to do is to develop what I like to call a patient-centered approach to dealing with these diseases. One of the things we discovered when we did a survey with patients with hypertension and diabetes, the hardest part for them was not taking their medication. The hardest part was changing their diet, okay, and worrying about the diabetes. So when you have diabetes or hypertension and you join our clinic, we actually give a team to work with you. So we manage your drug delivery. So we put you on a regimen of drugs and manage the diabetes. But we also work very closely with a nutritionist and a mental health expert, because you know all this thing is in the mind. Yeah, it's in the mind. So we are really trying to have that what I would call a holistic patient-centered care. I'm sure many of you, I don't know if any of you have ever interacted with the Indian healthcare system, yeah, vis-a-vis the Kenya one. I had the opportunity to interact with it a couple of years ago. But what really amazed me, and now I understood why everybody's running to India, okay, is because these people actually design their healthcare around patients. So the patient does not have to cross, you know, town, country to look for a doctor. They actually make sure that everything the patient requires is around them, okay? If they need the doctor, if the doctor needs another doctor's input, all of them come as a team, surround the patient, and deliver the best care possible. And we have seen what happens. Outcomes are better, recovery time is better, yeah? In Kenya, we have a linear approach. You see one doctor, and then he hands you over to another doctor, then they hand you over to another, and they never even sit together and say, let us talk about Harriet. What have you noticed? Yeah. So you will find now in our setting, we've tried to do the same. So Harriet has diabetes. the doctor will ask the nutritionist, is she managing with her disease? Then the psychologist will come and say, actually, no, she's not, because she's worried about this. Her coping mechanism sometimes involves alcohol or whatever it is. So we have a very, very holistic approach to managing patients. Next slide, please. Okay. And then also what we've also realized, and I was talking to a friend of mine who works in this consumer survey companies. More and more people are looking for the efficiencies they see in certain sectors, in all the sectors that they deliver. Who would have imagined that you can do all your banking on a phone? Yeah. Some of us have not stepped into our banking hall, for a very long time. M-Pesa is an innovation that was revolutionary. And therefore, we need to ask ourselves, can we transfer some of these conveniences and innovations into healthcare? So for us at Strathmore, what we've done, especially during this COVID time, we've also started a telemedicine service. Yeah. So all our clients who are not comfortable to coming into hospital for whatever reasons, maybe because you're high risk, you don't want to expose yourself, we have a telemedicine service, which you actually just call the doctor, you can video call with the doctor and get your consultation done. And the beauty about this, it is also works with people who don't have smartphones, yeah? So even if you're in the village and you're far away, there's no internet, you can still be able to access care through a phone, yeah? Also, we are working very much on patient flow time. This is always the biggest headache when you go into a hospital, yeah? How long will I spend there, yeah? If you're lucky, maybe they will have some internet and you can continue doing your work. But we are firm believer that there are so many germs in hospital, you do not want to keep people there unnecessarily longer. Then, of course, payment methods are also very important. So we've worked on that as well. We have cashless, we have M-Pesa, we have Visa. So mobile payment methods. We have Visa. We have, basically making the journey simpler. And then, of course, we were opening for long hours, but now, of course, with COVID, we had to reduce. But the idea is that, you can get care at any time. So when we are closed, we encourage most of our clients then to move to our telemedicine online service. Okay. Then we've also partnered with insurance companies because they are very important. So those are just some of the insurances that have accredited our medical center. So you can access care. Then also as an academic institution, we've been very lucky to form also global partnerships. Yeah. So right now we are in partnership with about these three organizations, and it's all about access. How do we make medical care very accessible? I'm sure if you've ever gone to hospital and looked at your medical bill, a big chunk of it will always be drugs. Yeah. Yeah. So we are working with different partners to see how we can get good quality drugs at a cheaper price to the patient. Yeah. Because at the end of the day, we know if price is a barrier, yeah, then the treatment will be compromised. Yeah. Because if somebody can't afford their medication, really there's nothing that can be done. So we are working with different companies, different partners to see how we can bring down the cost of medication to all our clients. Okay, next slide, please. Okay, so as I said about screening, so screening for us is very big. We've taken it in a big way because 70% of our population are students. So the sooner you get younger people into the habit of screening, it is very powerful. Yeah. If they get into the habit that, okay, every year I need to go for a checkup, for whatever it is, yeah. And we normally do medical checkups depending on your age band, yeah, and your family history. But it is something I really, really recommend for everyone now. as I said, let us adopt a proactive, a wellness approach to how we manage our care and not wait until the last minute. I always say people are more diligent in taking their cars for service than their own bodies. Yeah, we will put there every 3,000 kilometers or whatever I will go. But our bodies, we go 3,000, 5,000, 10,000, we never go for a checkup. So checkups become very, very important. Next slide, please. Okay, so that comes to the end of my presentation. I'm ready to take questions. I would really love if you could follow us on our social media handles. You can find us on Facebook, Instagram, on Twitter. We also have a website, and with our website, you can even book your appointments online. You know, right now we're trying to manage crowding in hospitals, so we are really encouraging people to book appointments to manage the social distancing. With us, it is very easy. You just go to our website, you press on the tab, request an appointment, and one of our front office staff will get to you and be able to book your appointment. So when you come, you do not waste time, and then you're not worried that there are too many people, because that's how we manage the crowds. So thank you very much. At this point, I'd like to take any questions from the participants.
Thank you. Thank you very much, Harriet, for that awesome presentation. It was very sober and very informative. So there is a question. I have 4 questions. The first one is, what has been your greatest challenge in maintaining protocols at the university while dealing with students and especially millennials?
Yeah, that's a very good question. I wish I knew who had asked it. Oh, you don't know? Okay. In fact, that is another thing I wanted to mention, that especially now, I'm sure a lot of you are working on return to work protocols. How are people going to work? And it is a challenge. Remember, the biggest thing I said that is hard to change is behavior. Okay. So first of all, you have to make sure your protocols are in place. So I'm assuming the organizations you work with have protocols in place, very clear protocols. I would highly recommend you have protocols on entry. Yeah, what are you doing to screen people before they walk into your organization? I would also even go a step before that. Do you have a mechanism where employees can reach out to HR or their head of department if they have been exposed to COVID or are not feeling well? So protocols are very important. And you know, like with any, it's going to be a big change management project. Okay. And I always believe change comes from the top. You have to identify who your most influential stakeholders are. And sometimes it's not us in management. It could be, you know, the head of the welfare committee, yeah, who can pass the message very quickly. So you need to find out who will be your champions, okay? Who will be your I don't want to call them COVID champions, but who are the people we're going to call and rally to action within our organization to help. So you need to identify your champions. Champions do not necessarily come from management. This is one thing I've learned. Yeah. You will always, you will know the popular guys. Maybe there are some guys who like to watch football together, or a group of ladies, you know, they have the leader who takes them for aerobics, or I don't know, there's a merry-go-round leader somewhere. We need to map up who these influencers are in our organization. And those are the people we have to bring to the table and convince that it is very important to follow these protocols. Then, of course, there's the physical infrastructure that you have to prepare. Yeah. Do you have clear markings, signs? Have you looked at how in shared offices, the research has shown people in shared offices are more vulnerable to infection than people in isolated offices. So have you mapped out your organization? Have you, sometimes, you know, you might I go to places and they put a sign, sit here, don't sit here, sit here. Then where they've written don't sit here, somebody goes and sits. you know. So can you physically, can those pieces of furniture be physically removed? So you walk in here and there are only 3 desks. You cannot bring a 5th one and a 6th one, yeah? So the infrastructure change has to be very visible. A lot of signage. Also, what is being recommended by the DOSH is that all staff should be trained, yeah? So you need to have some training program and roll it out, so everybody knows what is expected. Our students are coming on the 5th of November, and we are all shaking in our boots because, you know, young people, they like each other. Yeah, they want to be close to each other. They want to. So what we're doing is having more of a phased approach. So the online classes will still continue, because there's some who might be high risk and they don't want to come, so they need to be given the option. But to try and control the numbers, you need to look at your classes, make sure you don't have 50% people on campus every time, because the more people there on campus, the tendency to crowd already happens. If you have eating areas on campus, I'm not thinking about, because Mr. Ndegwa talked about your students coming for face-to-face learning. Yeah, that physical, your cafeteria, if it had 10 tables, now it needs, 5. If there were 4 chairs around the table, now they need 2, So those are some of the things we've put into place. If you have a student council, get the student council members on board. Here I'm talking about institutions of education. Again, if it is other organizations, for your influencers, yeah, get your influencers on board. They always say it's a mixture of carrot and stick. You incentivize. I think also you have to have some consequences if people don't follow protocols, because we are all responsible for everybody's health at this point. Yeah, I may have COVID, yes, so I need to protect you from getting it. If you have an office that has an unusually high number of young people, remember 80% of the people in Kenya are asymptomatic carriers and are between the ages precisely of 18 and 35. So they will have COVID and they won't have symptoms. Yeah, so we need to be aware of that. So they need to wear their masks, because they may be carrying the virus, but they're not getting symptoms and therefore could infect other people. It is a challenge, but I tell you, it is worth it. I think we will all come out better at the end of this pandemic when it comes to public health matters.
Thank you, Harriet, for that very comprehensive response. There's another question which is really broad. So what is the aftermath of COVID-19 in Kenya? And maybe I can combine it with some question here. How do we ensure the health of other people are good as you put others into consideration? And I think the next question is related. How do we come up with a sustainable health and investment?
Okay, so I think you break it down for me, because there were 3 questions.
One is, how does the aftermath of COVID-19 in Kenya look like? Maybe we can
Okay, from a health perspective, actually from just general perspective, I don't think things will be the same. I was listening to an interview by a World Bank IFC advisor who was the president of the Central Bank of India. And he said that even as countries go into their recovery process, especially economic, we have to be very aware that things are not going to be the same. And what does that mean? Consumer preferences are going to change. Consumer priorities are going to change. Somebody was telling me, even people are going to, those brand loyalties we had to big brands like, I don't know, Blue Band and the rest, that is going to change. Yeah. So if you're an organization that is seeking to do business after COVID, you have to be very close to your customer and know what is happening to them. How are they changing? Are people seeking our services the way they used to? Okay. That is from a global perspective. And I think that will affect Kenya in a big way. People are even looking differently at how they manage their money. People are looking differently at how they're investing their money. Maybe many people will now prefer to rent than to build houses or take mortgages. So if you are into that, I think it's very good to read anything that is coming out on consumer insights, changes in consumer behavior after COVID, because the consumer will drive how we will recover. But one of the things that is coming out very clearly is the consumer is becoming more powerful. Okay. If they decide they're not using their product, there's nothing you can do about it. For us in healthcare, we are thinking the same. Our patients are also changing. Yeah. So whatever service we are giving to them, we have to meet them at their point of need. So that is how, of course, there's the economic slump that will come. There's some industries that will completely become extinct, but there are also new ones that will come out. So we all need to find out, put our hands on the pulse and be very aware of where these changes are happening. And you know the word now, it's VUCA, isn't it? Volatile, uncertainty, all what that acronym, yeah, that adaptability is going to be very important. Listening. This is a time of listening more than talking. Yeah, because we need to gather as much information from all our stakeholders. Then your next question, Phyllis, was?
Thank you, Harriet, about that response. How to ensure the health of other people are good as you put yours into consideration?
Yes. So as I say, we're all leaders in our own rights, yeah, in our homes, in our villages. And I think this is a good way. The more information you disseminate, the better, in whatever forums you have. We have chamas, we have investment groups. Instead of sitting down and eating mbuzi, why can't we go to Ngong, hike first, and then eat the mbuzi? You know, the interventions just need a little bit of creativity. And as I said, the hardest thing to change is human behavior. But if you want to change human behavior effectively, it has to be small things, but consistently. Yeah. In my family, you know, we can now just say, I think it's better for us to eat brown bread. Yeah, people might be up in arms, but after a while they get used to it. So all of us in our areas of influence, I think we can do a lot. I think women have a very good power here because we are in charge of the kitchen. Yeah, if we stop buying a certain food and we put a certain food, and people will have no choice but to eat it. So diet, encouraging exercise. How are we spending our free time? Instead of sitting and watching TV, can we go for a walk? We have beautiful forests nowadays by Kenya Forestry, Karura, Arboretum. Yeah, we go for a walk, we relax, we get some exercise done. And that is one of the, I think, the positive things that has come out of COVID. Nowadays, everybody's moving. They're walking, they're running, they're cycling. Yeah. And even those of us here who are in positions of influence, can we start lobbying government to make more recreational areas? Yeah. For people maybe who do not want to be, cannot belong to a club, or, but you know, more recreational areas where people can get fresh air and some exercise. Okay.
Thank you, Harriet. The last one is, what can you say about sustainable health and investment?
Okay, so as I said, with health, it is small things consistently done. I think the sustainability, that is the catalyst to change. So identify small things that you can do, starting even from today. Yeah, I always say the biggest factor of failure is to have very big goals, especially if something is difficult. Yeah. If you take 2 spoons of sugar, say from today I'll take 1. That's small, but consistently. Because small is sustainable. Okay. If the switching cost of the behavior is low, then people are very quickly to adapt it. But if the switching costs are very high, then you get a lot of resistance. So I'm a firm believer of small and consistent progressive change. Just small things. If you cannot walk for an hour, walk for 15 minutes. Walk fast, get a good sweat, sit down. Yeah. I always laugh at my husband. He just walks on the spot, when he's in a Zoom meeting or in a webinar, he doesn't sit down, he just marches on the spot. And I'm very impressed. He's able to cover about 10,000 steps every day. He has those step counting things. So small things that have low switching costs and you can do sustainably on a daily basis. I think that is the best way. Sometimes you get caught up in big things. I want to do big things. From tomorrow, I'm never eating meat. Okay. We'll start by eating, okay, I'll eat meat for one meal and then the other one I won't eat meat, So small, sustainable, consistent change.
Once again, members, we want to thank you so much for having listened in until this time. Finally, you will all agree with us that the presentation by Harriet is excellent. And she's given us a very good discourse on health matters during COVID-19. Even for the rest of us who are not medical doctors, we could follow through the presentation. So Harriet, for your presentation, we thank you so much. It was an excellent discourse, and we really did pick a lot in terms of the principles that you put across, and also in terms of the guidance and raised as members to consider and to ponder in regard to organizations. So shall we give her the usual ululations? And the thumbs up. Thank you so much, Harriet. Having said that, members, we have now come to the end of this presentation. We have come to the end of this discourse, and we thank you so much once again for logging in. I think at one time I saw we were 35, and even at this point in time, about 35. In fact, it's increasing to 36, meaning obviously that this has been a very good discourse. Harriet, we may call you once again. Please don't get tired. We may call you in the course of time. Again, also depending on members' questions that come across. We'll also kindly request that if there are any questions that are presented to us, we will send them over to you. You give us answers, and then we can share the questions and the answers to the members once again. Finally, members, please do let us know your email addresses so that we'll also endeavor to be sending you these presentations and also answers that may come through the questions that you raise. With that, we want to wish you wish every one of us a good evening. Enjoy yourselves, and above all, God bless you, and thank you so much. And please keep safe also. Thank you, and bye for now.